Stand by SOT1.
Standing.
10 seconds. Ready, roll in. Ready, SOT1.
Ready.
In 4, 3, 2, 1. Roll in.
From legendary Uncle Studios in beautiful Southern California, welcome to another edition of Work Comp Matters, the central location for you employees, you employers, and of course, we haven't forgotten about you damn independent contractors. And now, here's this week's edition of Work Comp Matters.
It is February 4th, 2022, 12 noon straight up. Welcome to another edition of Work Comp Matters. We're sponsored by mancavepodcasting.com. We've got almost 600 podcasts in the tank, completely free, no obligation, available to you 24/7. And if you want to do your own podcast, all you have to do is talk anywhere in the world. All you need is a smartphone or a computer, and we will manage, produce, direct, stream your podcast live with your content and into the cloud forever. Good afternoon, everybody. My name's Steve Appel. I'm joined by John Scalia, the madman across the water, the socialist voice of reason out in Munich, Germany. Stories in the news today that John and I believe interest you California employees, employers, and of course, we haven't forgotten about you damn independent contractors. State Inc.'s sweetheart deal with Kaiser Permanente jeopardizing Medicaid reforms. Los Angeles County outlines requirements for dropping mask rules. California vaccine Cesar, I think I said that right, Cesar, resigns. Medicare to let seniors get COVID-19 home tests at drugstores. Medicare will soon provide free at-home coronavirus tests. Petaluma COVID-19 testing site deemed suspicious. Stealth Omicron is spreading, but not so fast. Yep, it's still a pandemic of the unvaccinated, arguably even more so now. Why do some people feel shame at getting COVID? COVID shaming, that's funny. Outbreaks at ICE detention facilities raise concerns. White Californians accounted for more COVID-19 deaths in 2021. ICE's endemic COVID strategy, in other words, the pandemic is turning into an endemic. Expanded COVID sick leave in California could take effect next week. Petition effort approved to have LA repeal vaccination requirements for indoor spaces, but it won't be ready in time for the Super Bowl. But arguably, the Super Bowl is not an indoor space, it's outdoors. And then we have our next story from Politico, which John is going to read, and then John and I are going to talk about it. So without further ado, John, go ahead and take our first story of the afternoon.
Garcetti defends maskless photo at NFL game. I hold my breath. There is no CDC guidance that suggests holding your breath is equivalent to removing a mask in closed quarters or public settings, nor is there evidence that holding your breath would mean that there is a 0% chance of infection, as the mayor suggested. One 2020 MIT medical answer on holding one's breath to prevent the spread of COVID-19 said that in all likelihood, it's not at all helpful. Spokespeople for Garcetti did not immediately respond to requests for further explanation of the mayor's comments. Garcetti said, I wore my mask the entire game, and when people ask for a photograph, I hold my breath and put it here, and people can see that. The California Department of Public Health announced in December that it would extend its nationwide mask mandate in all indoor public settings. SoFi Stadium is an indoor-outdoor facility until February 15th, regardless of vaccine status. Latest data shows that LA County reported 102 deaths and 15,000 or so new cases related to COVID-19 infection. More than 70,000 people were in attendance at the stadium, which also has a mask requirement. Also photographed maskless at the game were San Francisco Mayor London Breed and California Governor Gavin Newsom, both of whom have been the subject of past criticism over public appearances without masks. So there you have it. The public officials were photographed without wearing their mask. According to Garcetti, he was holding his breath probably until he gets to India. Steve.
And this came about at last Sunday's playoff game at SoFi Stadium, which started with both Garcetti as well as Governor Gavin Newsom, the Gav, taking pictures unmasked with Magic Johnson. Now, Magic Johnson has been diagnosed HIV positive, so one could clearly argue if anybody has pre-existing conditions and or comorbidities, Magic Johnson does. So Magic Johnson was unmasked. And by the way, I don't believe any of the reporters are banging down the door to get comments from Magic Johnson. All of the, and none of it really been, I don't think Newsom has commented either, but of course, Garcetti is the main point of this story, quite frankly, because he is the mayor of Los Angeles, and it's arguably, it is not following the current mask dates, especially for super spreader events, which are more than 10,000 people. And there were easily 40 or 50,000 people there. Now, I have to ask myself one simple question. Do I really believe Eric Garcetti when he says he was holding his breath every time there was a photo op and he took his mask off? And the answer is no, I do not believe him. I think the mayor is lying, but I could be wrong. Also, that being said, Garcetti also said, and no one's called him on this yet, but I will, that except for the photo ops, he was wearing his mask the entire remaining time he was at the game. Now, hold on. Does that mean that Eric Garcetti did not have a sip of water at all during the game? That he did not have something to eat during the game? If you take the game plus the halftime activities, and presuming he got there a few minutes early and left at the end, we're talking 3.5 hours. Hey, Mayor, did you have a drink of water during those 3.5 hours? Don't tell me you took a straw and kept your mask on while you were drinking it. I don't believe that one either. Now, my closing thoughts on Mayor Eric Garcetti. This guy has got to be one of the greatest political speakers I have ever heard. Now, see, if you compare him to the Gav uses all complex words, complex phrases, refers to statistics, percentages, colors, and graphs. Like he's purposely using these big words to what I think is make up for his actual lack of knowledge of a topic. There are people out there that use big words to help encourage people to think that you know what you're talking about. I've always preferred to use as small and simplistic a word as possible, but that's just me. And of course, the Gav has this rough, gravelly voice, okay? And so you've got this good-looking guy who's standing up at the podium using these 6, 7 syllable words that I don't understand with this gravelly voice and attempting to sound considerably more knowledgeable on a topic than the rest. Okay, fine. Garcetti talks slower than the Gav. Garcetti talks clearer than the Gav. Garcetti uses smaller, more understandable words and sounds extremely empathetic, almost like you're talking to your therapist or your psychologist. Eric Garcetti, in that regard, is a fantastic speaker. If you ever get a chance, just look up any of Eric Garcetti's news conferences on YouTube. The guy is a fantastic speaker, but is he being honest when he says that, firstly, he held his breath every time there was a photo op? I don't think so. Do I believe him that except for the photo ops, he was wearing his mask the remaining entire time? Nope, I don't believe that either. So while I totally, and I'm not even talking about how he's governed Los Angeles, dealing with the crime, the taxes, the violence, the graffiti, gangs, the whole ball, that's for another story. Eric Garcetti, fantastic speaker, but I think you lied twice in one news report. John.
Well, I got to say that Garcetti I don't listen to Garcetti much. We hear Gavin Newsom a lot more because he's the governor of California. And when you're the governor of California, you're also on international TV. However, I would say, based on what you just said, the Garcetti's putting on an act, because Garcetti was a Rhodes Scholar. He has a degree from Columbia. He has a master's, and he studied for a PhD at the London School of Economics or the University of London. So obviously he has all the polysyllabic words one needs to use if he wants to and at his command. So clearly he just dumbs down his vocabulary or simplifies it, if you prefer a polite word, for public consumption. So as far as that goes, he's just putting on an act. I mean, the guy comes from a super privileged background, and he's got a super education beyond. I mean, really, really, really good. And the other thing is, as I said, he's getting out of Dodge, so he's not going to take any flack as long as his appointment to be the ambassador to India gets approved. He's out of the country. So I don't think he cares.
I would think that in some way, shape, or form, and I would think that this ambassadorship is a step towards the United States Senate, maybe to replace Dianne Feinstein or something like that. I think it's a stepping stone towards federal politics.
Assuming she's still alive when his term is up. I mean, Feinstein's what, 105?
Realistically, I think she's 91, or she's going to be 91 this year. Yes. Haven't heard much from Dianne lately.
I think there should be an investigation as to whether or not the super important politicians have a secret cabal where they've found a secret to longevity somewhere, for somebody who gives them treatments so that they never die. Who knows?
Yeah, it's called the 6-year term. Yeah, you're dialed into Work Comp Matters. We are, of course, sponsored by mancavepodcasting.com. If you want to do your own podcast anywhere in the world, all you need is a cell phone or a computer. The content's completely yours. We'll manage, produce, direct, get it streamed live and into the cloud forever. And if you don't have the coin right now, we've got almost 700 podcasts that are at your disposal 24/7. Anyways, here's the remainder of your news that John and I believe are of interest to you employees, employers, and independent contractors. Go ahead, John.
Well, we were just talking about Gavin Newsom, and this article is about him. State inks sweetheart deal with Kaiser Permanente, jeopardizing Medicaid reforms. Governor Gavin Newsom's administration has negotiated a secret deal to give Kaiser Permanente a special Medicaid contract that would allow the healthcare behemoth to expand its reach in California and largely continue selecting the enrollees it wants, which other health plans say leaves them with a disproportionate share of the program's sickest and costliest patients. The deal, hammered out behind closed doors between Kaiser Permanente and senior officials in Newsom's office, could complicate a long-planned and expensive transformation of Medi-Cal, the state's Medicaid program. It has infuriated executives of other managed care insurance plans in Medi-Cal who say they stand to lose hundreds of thousands of patients and millions of dollars a year. It has caused a massive amount of frenzy, said Jared McNaughton, CEO of the Inland Empire Health Plan, which covers about 1.5 million people. It goes on to say that Kaiser Permanente, the state's largest managed care organization, is one of Newsom's most generous supporters and close political allies. The new 5-year contract, confirmed by administration officials and expected to be announced publicly today, will take effect in 2024, pending approval from the legislature, and will make Kaiser Permanente the only insurer with a statewide Medi-Cal contract that allows Kaiser Permanente to solidify its position before California's other commercial Medi-Cal participate in a statewide bidding process. And after those plans have spent many months and considerable resources developing their bidding strategies. Does this remind you of the mask thing, Steve?
Yeah. Los Angeles County officials said yesterday that face coverings no longer will be required in certain outdoor settings once COVID hospitalizations drop, and indoor mask rules could be loosened after further gains. The county would enter this post-surge phase when coronavirus positive hospitalizations drop below 2,500 for 7 straight days, about 26% below the current figure. John.
This is from the Modesto Bee demographic shift. White Californians accounted for more COVID deaths in 2021. So finally, a blow for racial justice. Last year, as the vaccines against COVID-19 rolled out to the public, a startling demographic shift went completely unnoticed in California, according to new research from Stanford University and the University of California. The respiratory disease began killing more middle-aged white Californians than any other racial group. The dominant narrative in the media at the time was about how much success vaccination was having with creating large declines in overall mortality. But this research shows that it's also important to pay close attention to proportional changes within racial and ethnic groups, said Alicia Riley, an assistant prof of sociology at UC Santa Cruz. By July 2021, 36% of COVID-19 deaths in California were among middle-aged whites, Riley said, a figure virtually equal to the percentage of whites in the state population. Well, it's good to know that white people have finally stepped up. Steve?
The woman the Gav called California's vaccine czar is leaving state service for a job in San Francisco. She told employees Wednesday. Yolanda Richardson, the secretary of the Government Operations Agency, will take over San Francisco's Medi-Cal plan. She announced in an email. Her last day will be March 2. John.
Update. Hundreds of students again refused to wear masks in violation of state mandate. Hundreds of Oakdale Joint Unified students refused to wear masks on Wednesday and Thursday as parents protested California's mask mandate outside campuses, Superintendent Dave Klein said. Now you may well ask, where is Oakdale, California? Well, Oakdale is in the middle of San Joaquin County, you know, the place that's just like Kentucky. And the motto for the county or for the city of Oakdale is, where cowboys are king. Really? I guess so. And nobody ever said cowboys had to read or write, right? Students who did not wear or accept masks across all grade levels created a, quote, difficult, close quote, and time-consuming situation for school officials who are required by law to ensure students wear face coverings indoors, Klein said Wednesday. Small numbers of people protested, he said. They're very upset with the mask mandate, Klein said. They want to see that going away. But he added, this is something that we're still required to do. Klein said 375 students did not wear masks on Wednesday and 344 on Thursday. You know, it's nice to know that students in Oakdale Unified School District will protest against masks, but probably never in their lives will ever protest against racial injustice, social inequality, or corruption, or anything that matters. Steve.
By early spring, Medicare will allow California seniors to go to their local drugstores to get up to 8 home tests for COVID-19 each month at no cost, rather than requiring them to check to see if their insurance will reimburse them, federal officials announced yesterday. It's the first time that Medicare would be paying for an over-the-counter test for free, according to the United States Centers for Medicare and Medicaid Services. John.
Yeah, how long have I been saying that it's just ridiculous that the richest country in the world doesn't provide free testing or and free home kits to its citizens? You know, well, somebody finally must have got tired of me saying that. or simply decided, well, maybe it is the right thing to do. And it's amazing it took that long, but it's about time and good. Okay, this is from the LA Times. Patients are barred from doctor disciplinary hearings in California. That could change. Big emphasis on the could here. By the way, in case you don't know, doctors are a very privileged group. Tracy Dominguez has often thought about standing in the lobby of the Medical Board of California and shouting. Maybe then she would be heard, she said. Since her pregnant 23-year-old daughter, Demi, died in 2019 while under the care of a Bakersfield doctor repeatedly reprimanded for negligence, according to medical records, Dominguez has fought to have her family's heartbreak considered in disciplinary hearings by the medical board. Instead, she said state law reduced her daughter to being called patient one in documentation given to the board members who disciplined doctors. Her grandson, Maliki, delivered as Demi was dying, was described only as a 4-pound, 7-ounce male infant in the case against Dr. Arthur Park. In December, the medical board allowed Park to avoid an administrative hearing and surrender his license with the ability to apply for reinstatement later. Park could not be reached for comment Thursday. What a surprise. This is a tragedy that no family should have to go through, and then they make it so hard in the complaint process, Dominguez said. Our voices are not being heard. Now, here's what happens. For nearly 3 decades, California law has forbidden the state medical board from considering victim statements in their decision-making. Instead, a person filing a complaint to the medical board can provide a statement to a deputy attorney general assigned to their case. But those words are not allowed to be shared with board members who ultimately determine what discipline, if any, is warranted. People feel they don't have a voice in the disciplinary process, and they want to be able to tell their side and be heard, Hurtado said. I don't think they are expecting everything to change overnight, but it is something they desperately want. And so, this is, in other words, this is a hearing regarding public health and regarding issues that happen to citizens, and the citizens are not allowed to basically give their testimony to what is essentially the judge. I mean, it is, in fact, outrageous. And as the article points out, it's been the law in California for 30 years. And you can be sure that as this bill works its way through committee, the California Medical Association will bring out all their lobbyists, all their money, and they will fight it tooth and nail. Steve.
The new cousin of the super contagious Omicron variant of the virus that causes COVID-19 has not spread as fast as health officials had feared, raising hopes won't extend the devastating, the devastating case surge that has filled hospital wards this winter. The sub-lineage of the Omicron variant known as BA2 has been dubbed stealth Omicron because it is harder to detect, and its rapid spread in other countries has worried health officials that it could overtake the dominant Omicron strain and perhaps prove more virulent or vaccine resistant. John.
Sonoma vineyard workers fight for safety ahead of fire season. It's an uphill battle. Uncertainty and fear. Those are the words Anayeli Guzman, a farm worker from Oaxaca, Mexico. Sorry, I can't really pronounce that name. It's got too many X's. Used to describe her experience working in an evacuation zone during the 2017 wildfires in Sonoma County. Through a translator, Guzman recounted seeing flames as she picked grapes in a remote vineyard that had no exits through the forested area close by. Meanwhile, in a different part of the county, her daughter was being evacuated from her home, but Guzman didn't feel like she could leave for fear of being fired. Guzman found herself working in a fire zone due to what's known as an, quote, ag pass, close quote, a program established by the county during the 2017 fires to allow farm and vineyard owners, along with their workers, to enter wildfire evacuation zones in order to continue operations. This includes the crucial harvesting of wine grapes before smoke ruins the crop. Napa County and many other California agricultural counties have similar systems, none of which have been formalized by legislation. The Ag Pass is intended to protect the livelihoods of farmers, grape growers, and winery owners. Yeah, not necessarily the workers, though. But a grassroots effort that began growing in Sonoma County last year argues that it presents very real dangers to their workers, who are sometimes asked to risk their health and safety by entering smoke-filled fire zones. Called North Bay Jobs with Justice, a local coalition of community organizations, allies, and activists has created a list of 5 demands, including hazard pay and disaster insurance, that they want added to the Ag Pass program ahead of 2022 fire season. As the Sonoma County Board of Supervisors plans to finalize some of its legislative calendar on Tuesday, February 8th, the coalition is doubling down on its efforts. The effort, though, faces opposition. What a shock. County officials say the demands are unlikely to be added to the calendar ahead of the fire season, calling the issue far too complex to resolve with swift legislative action. Critics, mostly winery and vineyard owners or vineyard management companies, insist they are paying workers fairly and taking proper safety precautions. Gee, that's a surprise. They don't believe that they should pay for work that isn't completed, which would fall under the group's demand for disaster insurance. Some are even calling it, quote, a shakedown, close quote, fearing that this is a step in workers unionizing, oh my God, efforts that have long been thwarted in Napa and Sonoma. And there you have the bottom line, folks. The bottom line is that this is basically anti-union legislation, and they're doing, and all the powers that be are doing everything in their power to make sure it stays the same. Steve.
That's a good name for a podcast, John, if no one ever thought about it. The bottom line.
Actually, I hate to tell you, but I stole that moniker from one of my favorite shows on Al Jazeera, which is hosted by a UCLA alum named Steve Clemens, and it's called The Bottom Line, and it's an excellent show.
That is great. This following appears to be our last story because we are pretty much out of time. Question: is it still a pandemic of the unvaccinated? According to the Washington Post, yes, arguably even more so now. New data shows that the gap between vaccinated and unvaccinated Americans remains stark. I don't know what that means. I thought it was over 70%, but I could be wrong. In fact, when you compare unvaccinated people to those most protected by the vaccines, the gap has grown. The Centers for Disease Control and Prevention released new data this week from Los Angeles County. The data covered the period between November 7th and January 8th, which means the vast majority of cases involved came after the rise of Omicron. What you'll see right away is that there are indeed lots of infections among both unvaccinated people and vaccinated people, and specifically vaccinated people who haven't got boosters. Okay, so let's piece this together before the end of the show. People that have been vaccinated and boosted are getting Omicron. However, people that are unvaccinated are getting it more, and they're suffering more severe side effects, hospitalizations, and deaths. And those that are vaccinated but not boosted, those that are vaccinated but not boosted are having more severe side effects and hospitalizations than those that are not boosted, if I said that right. This is no surprise to me. I'm sure it's no surprise to John. But what I think lacks somewhat considerably in this story is the actual percentages. Like I said, I think the United States population, California, as well as Los Angeles, over 70% have been boosted. Now, yeah, well, you say, Steve, well, you know, that means 25, 30% or not, and that's millions of people. Well, yeah. I mean, if you want to be stupid and not get vaccinated, you know, what can I say? I'm not going to tell someone else what to do. They're going to make their bed and sleep in it. I know it sounds coarse, it sounds rude, but it is what it is, and that's the bottom line. John, closing thoughts, burning desires.
No, I think I editorialized enough when I was reading my articles.
All right, very good. Well, we've come to the end of another Work Comp Matters. Much thanks to John Scalia in Munich, Germany, Scott Walton from Legendary Uncle Studios, all the good people. I'm going to now start calling all the good family back at mancavepodcasting.com. My name's Steve Appel. We'll see you again Monday, 12 noon live for another edition of Work Comp Matters. Bye, everybody.